Welcome back. That was my attempt at a welcome back Cotter introduction, but welcome back. Yeah. Maybe the audience wants me to sing more.
We'll have to.
My kids don't.
Run a poll. Your kids don't.
But to the audience, welcome back to another episode of Skinfluence, the one-stop shop podcast for all things about your skin health and your health in general. And I'm Dr. Dustin Portela, and I'm a board-certified dermatologist.
I'm Austin Lee. I'm the co-host and physician assistant here at Treasure Valley Dermatology. And I'm excited to talk about all the things just off the top of our heads.
Yeah. It's one of the things we see pretty much every day. And today we're going to be talking all about your scalp health, the kinds of things that can go wrong on the scalp, and then how we treat them in dermatology.
Yeah. So what are some of the basics that you would talk to your patients about taking care of their scalps?
Well, as I mentioned in my Saturday Night Live commercial,
I knew this was going to
had to come up.
It has to come up.
Your scalp is skin, yo. Yeah. Your scalp is skin. It's a little bit different. It's got different structures in there, or more structures than other parts of the body, but it still is skin. And there are products that will help to treat specifically the skin. And so when you have a problem going on up in your hair, sometimes it's actually just happening in the skin itself. And it's not always just the hair. Yeah. So it's important to know. But essentially, you have hair follicles, you have oil glands, you have a little bit different environment because of the hair that allows certain things to grow that might not grow elsewhere on the body.
Right.
And you just have to understand that there are specific treatments for the scalp. We do treat it a little bit differently, but at its core, it is still part of your integumentary system, your skin, and we can take care of that.
Yep, that's what we're here for. We do skin, hair, and nails. So hair is a part of it. And hair is I'd say on a daily basis, a lot of the things that we treat involve the scalp.
Yeah.
If not the hair, the skin on the head, on the scalp. So there's lots of things that are involved there. Like you talked about, there's still structures. There's lots of hair follicles, which can mean lots of different things. Lots of different conditions can affect the hair follicles and the skin around it. So one of the main things that we see is dandruff.
Yeah.
A patient comes in, their complaint is, I just have really bad dandruff. What do you talk about when they say something along those lines?
Dandruff, everybody has probably experienced to some degree at a point in their life, and we'll distinguish dandruff from seborrheic dermatitis. And I guess we can probably talk about those two things together. But dandruff is generally perceived as mild flaking and dryness of the scalp. You classically see in the commercials where somebody's wearing a black suit, or you got the little flakes that are falling on the shoulders. It's a stigmatizing condition, but at its core, there is an infection of the skin going on. Yeah. And that's what differentiates it from the medical term of seborrheic dermatitis.
Totally.
And that's what we call it when you come into the clinic and you have dandruff. We're going to diagnose that and code it to your insurance company as seborrheic dermatitis. Seborrheic meaning the areas of the body that have lots of oil glands. Yeah. The head, the face, the chest, the upper back, where you have the largest concentrations of oil glands, and dermatitis just is inflammation. So dandruff is usually very mild. You can treat it with over-the-counter options, whereas seborrheic dermatitis often requires prescription treatments to really make a significant difference.
Totally. Yeah, when an MA is presenting the patient to me and saying their main complaint is dandruff, my immediate thought is, they have seborrheic dermatitis.
Right.
So, and there are things, seborrheic dermatitis crosses over. It can look or kind of be a precursor sometimes, we think, to other conditions such as psoriasis, but seborrheic dermatitis, or dandruff as is most commonly called, is a relatively easy treatment. So people come in thinking, I've had dandruff my whole life, I've tried every over-the-counter shampoo, nothing's helping, and they just kind of lose hope. Yeah. But there are prescriptions that we prescribe, prescription shampoos and solutions for after the shower in case if the scalp's really itchy or inflamed or red, that can calm this down, and you can live wearing black shirts again and not worry about the snowflakes.
Exactly. At its core, seborrheic dermatitis is caused by a yeast that lives on the skin. It's called Malassezia, and this yeast is a normal, we call it a commensal organism, or part of the normal flora of your skin for pretty much everybody. Yeah. And in some individuals, it overgrows. You get a larger population of it. And when your immune system starts to react against that, to fight it off, you will see the signs of seborrheic dermatitis, which are inflammation and itching of the scalp, so it may be more red. you typically will see more oil production in people with seborrheic dermatitis because the yeast lives off of the oil that your skin produces.
Right.
So it's breaking down the oil as its food. So people who are more oily are more likely to get seborrheic dermatitis. But when we treat it, we're essentially bringing the population of these yeast down to more normal levels.
Yeah.
And we see, whereas we'll talk about psoriasis in a moment, which is usually more dry, seborrheic dermatitis, we call it a greasy yellow scale because of that oil.
Yeah. Have you ever had seborrheic dermatitis?
I've had very mild dandruff at different times,
Yeah.
but never where I would say, yeah, I've got subderm.
Yeah. I do. I get it occasionally. I get flare-ups every once in a while, and I'll get that, my hair feels greasy. I get it in my ears. So another common place to get seborrheic dermatitis is the ears. And yeah, it gets itchy. I know it's flaring up because I don't consciously know it, but I'll be like, my hand will be always scratching my scalp, and my wife will be like, stop picking your scalp. I'm like, oh, I need to use the shampoo again.
Yeah. So it can get in your ears. You mentioned that, which is something a lot of people don't think about. I did a YouTube video on itchy ears and went over all the potential causes.
Yeah.
Because pretty much everything we're going to talk about today can also affect the ears, whether it's in the ears or behind the ears. And the video did way better than I expected it to.
Really?
It was a much bigger problem that people experience than I would have guessed.
Interesting.
Even though I see it, all the time.
Yeah, but people are silently struggling with this.
Silently struggling with itchy ears.
So let's talk a little bit about psoriasis of the scalp then, because seborrheic dermatitis, there are some textbooks that kind of think that seborrheic dermatitis is kind of on the spectrum of psoriasis. People who have sebderm maybe are going to have a higher chance of developing psoriasis later down the road. I don't know if that's true or not, but I've read it a few times. I'm like, that's interesting. But psoriasis is an autoimmune condition, so the yeast may play a little bit of a factor there, but the main thing is it is your immune system that's driving the condition, causing not so much the greasy scalp, but just very inflamed, thick plaques that are flaking like crazy and red.
Right. And I like to describe psoriasis as an autoinflammatory condition rather than autoimmune. When we think of autoimmune, your immune system is specifically attacking something in your body. So if you have lupus, it might be attacking your kidneys or it might be attacking your skin where it's causing cytologic damage.
Sure.
When you have an autoinflammatory condition, it means that there's cytokines or inflammatory chemicals in the body that are at higher levels than they should be. And those act as signaling molecules. And although they're not directly attacking your body, that inflammation is telling your skin cells to divide much more rapidly. And whereas your normal skin turnover might take 4 to 6 weeks from the stem cell layer up to falling off, in psoriasis, that process is shortened, and the cells are dividing so rapidly that they don't have time to detach from each other and fall off. And so these plaques of skin cells can build up, and sometimes they might be just a millimeter or two thicker, and sometimes I've seen them several millimeters, half an inch thick of plaques. And when the skin cells are stuck on there, they're pulling on your hairs, they get incredibly itchy, and you have a red base, and it's characterized as a silvery scale.
Yep. The mycosis scale, and it is usually more itchy than seborrheic dermatitis is. There's definitely the crossover, the SIBO psoriasis, where it looks pretty inflamed, but it's not quite these thick plaques. And the fortunate thing is we treat it relatively the same at the beginning with the ketoconazole shampoos, clobetasol scalp solutions. But then eventually the scalp can be a difficult place to treat sometimes. And so we need to use more aggressive treatments. But yeah, those are definitely the two main things I think I see on the scalp. There's the pityriasis. I say this wrong every time, but amenorrhagia. Or I don't. Do you say it differently?
I say amenorrhagia.
Amenorrhagia.
I can't guarantee that I'm saying it right.
Yeah. And that is just it almost looks like a bird pooped on your scalp sometimes. And you need some oils or things like that to really break up that really thick scale. But that's always a fun one to diagnose.
Right. We don't see it that often. It seems to be more common in kids that are not, exfoliating the scalp or scrubbing when they're doing the shampoo. But so we've talked about psoriasis, that autoinflammatory condition. Obviously, seborrheic dermatitis primarily occurs on the scalp, but can occur on the face or in the beard, around the eyebrows, the sides of the nose. Psoriasis can occur anywhere on the body. It can be just on the palms and the soles. It can be just on the scalp. It can be just in your ears, but it also commonly happens on the knees, the elbows, on the backside, or on your trunk. So psoriasis can be more whole body than seborrheic dermatitis tends to be.
Right.
And then the other thing that we'll see occasionally, not a lot in the derm clinic, but something that people may just deal with, is product buildup.
Totally.
Not for me, because I don't use hair products as a bald man, but more for women who may not wash their hair often. They're using dry shampoo a lot.
Totally.
And that residue builds up in the hair, and it can start to get a little itchy in and of itself.
Yeah. Some hairsprays as well. If they're doing hairsprays with other things, can build up. But definitely, it's been a few times where people come in and you're kind of picking through their hair and your hands get a little sticky afterwards. But
it happens. It happens from
it's
time
okay.
to time. So now that we've kind of outlined the main conditions of the scalp, this is the problems that we see most commonly. But if you'll remember from a previous episode, we talked about lots of different types of hair loss, and that is a scalp problem, could be a whole body problem. But those are sometimes, due to hormones. They could be due to autoimmune conditions like alopecia areata. That's not necessarily the focus of this episode today, but I do want to remind people about the different conditions that we treat on the scalp. And there's many types of hair loss that we treat every day in the clinic.
Yeah, totally.
Now that we've outlined the main things that we treat in the clinic, the next segment, we're going to move on to the treatments that we choose, the things you can do over the counter, the things we will send in by prescription. But first, I've got a little Did You Know?
Let's hear it.
All right. Austin, did you know that psoriasis is not just a skin condition? I know that you know this, but I'm just playing along for the audience. But
I'll play along.
Yeah. Psoriasis can affect the joints. About 30% of people with scalp psoriasis will go on to develop psoriatic arthritis, where that same inflammation that affects the scalp and causes that skin to get thick will lead to inflammation and pain in the joints.
Yeah, doesn't sound fun.
No. So people often, if I'm looking at their scalp and I can't tell if it's seborrheic dermatitis or psoriasis, if there's some overlap or it's not really well developed, I start asking them about their joints, and they're always confused as like, what do my ankles have to do with my scalp?
Yeah.
But it is important to know if you have got some buildup on your scalp and you're waking up stiff and sore every morning, you could have psoriasis of the scalp and psoriatic arthritis. And that is something you absolutely should see a physician for.
Totally. Interesting. And so I was looking for those little clues. That's what I like. Well, I have a did you know that you probably know.
Yeah.
But did you know that the scalp has more oil glands per square centimeter than the face?
I think I kind of knew that, but I didn't quantify it or anything.
Yeah.
But I know we have a lot on our face.
There's a lot on the face.
But
it makes sense that there's a lot on the scalp, which can explain why sometimes at the end of the day, your hair is really greasy, especially in women who aren't washing their hair, but their face feels dry.
Yeah. Another thing that we have learned in the field of dermatology is that individuals with Parkinson's disease have a lot higher risk of seborrheic dermatitis. And I have referred patients to neurology before who they don't yet maybe have that tremor of Parkinson's, but they're kind of that, we call it a stone facies, where they're just less expression on the face. And I'm seeing a lot of oil and maybe early dandruff on the scalp. And I may mention to them that you should talk to your family doctor about screening for Parkinson's disease.
Interesting.
And so it's something that's very common. And if you're ever around somebody that has Parkinson's disease and they'll let you look at their scalp, it's probably going to be a lot more oily, and the chance of having dandruff up there is really high.
Yeah, and it's harder to treat.
Yeah.
Maybe it's just getting the medicines on or things like that, but for some reason it doesn't respond as well.
So
interesting.
Very interesting.
Yeah, I've never sent a patient to neurology early. Maybe I should consider that.
I've caught Parkinson's disease 2 or 3 times in my career.
No kidding.
Yeah.
That's amazing.
And the first time it happened, I didn't refer them, but I had the thought after seeing the patient that, they kind of have some Parkinson's type signs. It wasn't obvious. And then I saw them a year or 2 later, and they let me know that they had just been diagnosed with Parkinson's. I'm like, I felt bad because I didn't say something.
Yeah.
I don't know that it would have made a huge difference when they were a year away from diagnosis anyway, but then I decided I'm going to say something next time I see it.
Yeah, that's awesome.
Well, let's move on to the treatments for the scalp conditions.
Yeah. Do you have any over-the-counter treatments that work well for, let's just say, seborrheic dermatitis, dandruff?
There's a lot that you can get over the counter, and the first one that I'll recommend is called Nizoral shampoo is the brand name.
Yeah.
It's a 1% ketoconazole, which is an antifungal medication that directly treats the Malassezia yeast.
Mm-hmm.
Ideally, with any of the shampoos that we talk about, you want to scrub them onto the scalp. They're not always the best shampoos for your hair, so they're a medication for the scalp. Scrub it in. Try to let it sit for 5 to 10 minutes before you rinse it out.
Yeah.
And ketoconazole will work better. It gives it time to act on that yeast that's living on the skin. But we often prescribe a 2% ketoconazole shampoo. So it's double the strength. It's certainly more effective. It's a generic, and it's really inexpensive.
Yeah. You mentioned leaving it on the scalp. That is the key, because I have patients who will come back and say, I use the prescription and I'm still getting dandruff. And I'll ask, how long do you leave it on? And they say, oh, I wash it off like after a minute or two. And it's like, it needs time to work. That's the key.
Right.
There have been some other good ones coming out lately. Vichy, I believe is the name of the brand. Vichy.
Yeah.
Vichy just released an anti-dandruff shampoo, and they have clinical studies, and it's comparable to 2% ketoconazole shampoo.
Yeah. The main ingredient in the Vichy, the sub-brand is called Durkos. And Durkos has been available in Europe for a long time. I actually did a social media promotion with them in like 2021 or 2022.
Oh, really?
Before it was available in the US. I was confused why they wanted me to talk about it, but I do have, some international followers. And selenium sulfide as the active ingredient is very effective. And they have a shampoo, a conditioner, and they have a leave-in scalp spray with salicylic acid in it.
Oh, really?
And I had these products here in the clinic, and I had a patient in who we'd been treating their seborrheic dermatitis. They weren't quite getting better the way that we want. And I grabbed the full-size trades that I had because I don't have dandruff, I don't have hair, I don't need it. And I gave her the shampoo and conditioner and the salicylic acid spray, and it was a remarkable transformation.
Wild. Yeah, that's interesting.
It was really good. Selenium sulfide is a great ingredient. And if you get dandruff on the face, you can also wash your face with these products. And again, try to let it sit for a few minutes.
Yeah, very often I'll prescribe ketoconazole shampoo and things, and I'll say, I want you to shampoo your face or your chest or where you're getting that type of condition. It's all, you always get to look like, shampoo my face. But yeah.
Then after selenium sulfide, the other ingredient that you can look for over the counter is going to be pyrethioin zinc.
Yep.
Pyrethioin zinc is the main ingredient in Head & Shoulders. Head & Shoulders has been out there by Procter & Gamble for a long time on the market. They're probably the biggest anti-dandruff shampoo on the market. And then CeraVe released their own pyrethioin zinc just this year. Obviously, that's why I went to New York and did the SNL commercial.
Yeah.
And they both have that pyrethioin zinc in there, which also in clinical studies that Procter & Gamble showed us when I went to their headquarters, they showed that pyrethioin zinc was slightly more effective than even ketoconazole shampoo.
Oh, interesting.
So I think that these all have great potential. And oftentimes what I'll recommend to patients is that they rotate their shampoos. Yeah. So they'll use one 2 to 3 days a week and the other 2 to 3 days a week in order to get broad spectrum coverage and more likely to eliminate the yeast buildup that's leading to the condition.
Yeah.
So I do really like the CeraVe brand because it is fragrance free. And that's something that's hard to find in a lot of shampoos because that's the market. People put in the floral scents and all these things to really provide a great user experience.
Yeah.
And if you have a scalp issue where your skin barrier is compromised, you don't want fragrance up there. You're more likely to become allergic to it.
And some of these ingredients don't smell great.
Right.
Another one that I'll recommend if there's a lot of itch involved with the scalp, and I'll have them rotate through the Selsun Blue or the Vichy's or the ketoconazole is T-gel.
T-gel, yeah.
I use T-gel personally. I know it does not smell good. It smells like tar. It's a tar-based shampoo. It stinks the whole bathroom. Your wife's going to yell at you. But it does help me. It helps my itch, especially any inflammation going on in the scalp. Yeah, it seems counterintuitive, but that tar-based shampoo is very anti-inflammatory on the skin. Really does a great job of breaking up scale if you're getting a lot of scale.
And that's something, tar-based therapies also can be used for psoriasis. So if people have thick plaques of psoriasis on the scalp, T-gel is a great shampoo for them as well.
It's becoming harder to find, unfortunately.
Yeah.
But it is a good option.
It's a good option. And then T-sal, also, both of those are made by Neutrogena.
Yes.
T-sal does not have the tar in it, but it's a more salicylic acid base to really help to break up scale. So that would be effective in psoriasis or seborrheic dermatitis.
Totally.
And then I want to make a plug for a product. I think it is kind of hard to find, but if you have that really thick buildup of like pityriasis amenorrhoea or really bad seborrheic dermatitis or psoriasis where it's just thick, adherent scale, there is something called Baker's P&S solution. The letter P and the ampersand sign S. And I said this on a video once. I was like, if you got this kind of build up, get Baker's P&S. And like I had so many comments of people thinking, did you just tell me to buy Baker's penis solution?
That's
like, no,
amazing.
I've got to enunciate better.
That's something else. That's amazing. I actually have not heard of that.
Yeah, it's incredibly effective. It's a little expensive. I think you can still get it on Amazon. It's like $30-40 a bottle. And it's a solution you put on there and let it sit, and it really soaks in and kind of breaks up that scale.
Interesting.
So
yeah, I'll have to look into that.
Really good option.
That's
and
great.
then prescription-wise, there's things that we can add on in addition to the shampoos that we've covered. But in many cases, the over-the-counter shampoos do a great job.
Yep.
Any other approaches you take, both with seborrheic dermatitis and psoriasis of the scalp?
We've basically covered what I do. I'll have them alternate between shampoos. I'll use a salicylic acid-based shampoo typically, or a selenium sulfite, and then I'll have if they're itchy, I'll throw the T-gel in and have just every day use a different one, just rotate through, and then the ketoconazole shampoos as well. And then if they're really itchy, we'll do clobetasol scalp solution for after the shower to try to calm down the inflammation of psoriasis. Typically, you don't need it for seborrheic dermatitis too often, but it's helpful in itchy cases. Those are really all the main things that I use for conditions of the scalp that we see regularly. Yeah.
I'm pretty similar. Steroid solutions, I do use them regularly, but it's important to know as a consumer how to use them the right way.
Yeah.
It's less is more oftentimes.
Totally.
I tell my patients 2 or 3 drops in the front of the scalp, 2 or 3 drops in the back. Work that in with your fingers and then go to bed. And usually after just a few days, things are going to get significantly better. And I don't want my patients using this every night for weeks on end.
Exactly.
Because it can thin the skin. Now, your scalp is a little more resilient than other areas of the body.
Yeah.
But you still don't want to be using a steroid all the time.
You don't want to get in the habit.
Yeah. There was a new prescription that was approved for seborrheic dermatitis and psoriasis this year called Zoryve.
Yeah.
Zoryve is an anti-inflammatory. I think it's a phosphodiesterase 4 inhibitor.
Yep, that's what it is.
PDE4. So it hits a different inflammatory pathway than the steroids do, and it's not a steroid, so it's not going to thin the skin. They made a foam that's very easy to use on the face or to spread through the scalp, because that's the biggest challenge. If you've got a cream or an ointment and you have hair, you can't get it through there.
It's hard.
But the foam does spread nicely through there. So that gave us another option for treating both seborrheic dermatitis and psoriasis.
Yeah. And it can be preventative, which is nice. You can, if it's just something that keeps recurring, you can use it on normal skin without risking thinning it.
We've got a handful of other steroid-free creams, but again, it's just how easy is it to use through the scalp. I like Vitama a lot. It's pretty thin. You can get it like at the edges if you have psoriasis on the edges, but working it all the way through the scalp isn't super feasible. And for really bad seborrheic dermatitis, I will sometimes give patients oral antifungal medication, like fluconazole. Many women will take this if they get a yeast infection, but oftentimes 1 or 2 doses will knock back, 50% or more of that seborrheic dermatitis.
Yeah, so I definitely use that when I see it more widespread scalp, ears, face, maybe a little on the chest and back. So,
an important thing to note, I would say, about the shampoos is that if you're using, for example, Head and Shoulders, or you're using CeraVe, or you're using Durkos, is you should also use the conditioner by those same brands. They've gotten a lot better so that they are great products for your hair. The prescription ketoconazole is not a great hair product.
No.
And people sometimes complain it strips color if you artificially color your hair.
Yeah.
But what we want to do when we use these shampoos is we want that pyrithione zinc or that selenium sulfide to be left on the scalp. And if you use that shampoo and then you follow it up with any other conditioner, it's usually going to strip that away. But the conditioners by the same brand that are paired with the shampoo are designed not to strip away the pyrethioin zinc or the selenium sulfide so that it can stay on the scalp and remain active even after your shower.
Oh, that's a great point.
So good little hack if you've got this problem, and you get some benefit from the shampoos, but not as much. Just make sure you're using the conditioner that pairs from the same brand.
Yeah. And I felt with ketoconazole, if I leave it on long enough, my hair feels stiff
and dry.
Yeah. And so using a conditioner afterwards can be beneficial. But yeah, they're all releasing conditioners with the shampoos. That makes sense.
Yeah. So obviously it's more market share for them,
Totally.
the chance to sell another product. But I was very impressed. I did get to visit the Procter & Gamble headquarters in Cincinnati last year and had a presentation on dandruff. And they showed us the technology that they formulate the shampoo and the conditioner with to make sure that they're not removing all that pyrethioin zinc from the scalp when you use the conditioner.
Oh, that's awesome. It's good to know they're looking at it from all angles. And I like to hear stuff like that.
So as we close out today, I do not have a product of the week here on the table, but we do want to just share with you guys the CeraVe Hydrating Anti-Dandruff Shampoo and Conditioner. We've had great results with it from our patients. We'll also have a link to the Durkos products because we've seen good results with both of them in the clinic.
Yeah,
so.
I use the CeraVe ones pretty frequently. They're great for your druff.
They're great for your druff. You don't have to get in a scruff about druff because you got CeraVe's new anti-dandruff.
There you go.
I'm going to link the commercial. Selfishly, I want you guys to watch it. If you haven't seen my Saturday Night Live appearance,
it's a funny commercial.
It's
entertaining.
It was the most fun I've had on a video shoot. So
yeah,
so
it was a good ad.
So thank you guys for joining us. I'm Dr. Dustin. You can find me on social media on all the platforms at Dr. Dustin Portela.
And you can find me anywhere on social media at Austin Lee PAC.
Send your questions to us at skinfluence_pod on Instagram. I think we'll be gearing up for maybe a Q&A episode, a little Ask Me Anything between Austin and I. And we'd love to have you guys' feedback on that. And we'll catch you guys on the next episode.